So I guess to me, resilience means that you have the capacity to deal with stress and deal with disappointment in a healthy and positive way, and that you're able to bounce back and learn from your mistakes and things that don't go the way that you plan. I think it's really important to have resilience and an approach to coping with stressful situations and disappointments in medicine. I think being a junior doctor is very difficult at times, and I think that for me, certainly, I wasn't prepared for the transition between medical school and becoming an intern. I think that not only do you have to deal with stresses in your day-to-day job, such as keeping on top of all your paperwork, making sure you're checking everything, making sure you're doing all the right jobs in the correct order, but also reviewing patients after hours for the first time, dealing with death, dealing with, extremely upsetting circumstances that you're not used to dealing with. I think that it's something that is very difficult to teach about. Everyone that gets into medical school is obviously extremely intelligent. I think the whole process of getting into medical school is difficult and it's becoming more competitive to get in. So I think it is attracting personalities that are used to being very good at what they do. And I think being a junior doctor, you are thrown into the deep end and it's all new and all terrifying. And I think that when you finish medical school, you feel like, okay, I know things, I can do this. And then internship's a completely different ball game. And I think that it's hard for people to admit that they're struggling. It's hard for people to say, oh, well, hold on, I actually do need help. I think we're all very good at pretending that we're coping and pretending that we're okay with things, and not really talking about it. I used to look around at all the other junior doctors and think, oh God, they're coping with things a lot better than I am. They're on top of their workload. How are they not getting stressed out about this? How are they not getting upset by, missing this? And it took me a while to talk to other people at my level and registrars and bosses about their experiences. And it's surprising how many people are feeling the same way as you are. I think if I was to go through internship again, and advice to the new generation that's coming through, I think I'd like to know that it's okay not to be perfect. It's okay not to know everything because you're not expected to know everything. That's why we're training. That's why we're in a teaching hospital. I think that the more you go through, the more you realise it's okay not to be perfect. I think the most important thing for me is turning up to work every day and wanting to learn and being willing to learn and improving on things that I might have missed in the past and changing my practice, because at the end of the day, patient care is the foremost of what we do.